Very good afternoon, friends. This is a short video lecture about IAOS new antioxidation procedure. I am your teacher and mentor, Dr. L. Prakash, Indian Academy of Orthopedic Surgeons, in association with Global Academy of Molecular Therapeutics and Ozone and Molecular Therapy Association is responsible for continued education in molecular therapeutics. Not every human being is fortunate to live in such pristine surroundings. Many of us have to bear the torture of pollution, hydrocarbons, pesticides, food additives, food colorings, preservatives, contaminants, and other chemicals which have become a part of our life. Hydrogen is the most abundant molecule in the universe. Since our science days, the first element in the periodic table, the lightest of all elements, is H2, hydrogen 2 molecules, and there are less than 20% elements in the world, compounds in the world without hydrogen in them. And yet molecular hydrogen in its native form is unknown on the earth or the planet on which we live. Molecular hydrogen is the most powerful antioxidant, very powerful detoxifying agent, and body cleansing molecule so far known to man. What is glutathione? This is a superoxidant molecule, again working against the body oxidants. This is a tripeptide, cysteine, glycine, and glutamic acid, and it is very surprisingly found in high levels in every single cell of the human body. The concentration of glutathione in our body cells is as high as glucose, potassium, cholesterol, sometimes as high as even sodium. This shows the level of various constituents in our blood which are normally found in blood testing, and glutathione forms a fairly high ratio. Glutathione exists in the cells in two states, the reduced state GSH and the oxidized state GSSH. Oxidized glutathione is actually two reduced glutathiones bound together at the sulfur atoms. For oxidizing glutathione, you need free radicals and other toxins that are torturing our body anyway. The ratio of GSH to GSSG determines the cellular redox of the cells. You can see the photograph on the left, which is electron pictomicrographs, which may be a little difficult for you to comprehend, but here you can see two pictures, one on the top and one on the bottom. One is a properly antioxidized cellular milieu, and the one in the bottom with starving cells at DNA level. Healthy cells at rest have a GSH-GSSG ratio below 100, while the ratio drops to 1 in 10 in cells exposed to oxidative stresses. Indication of the key roles of glutathione in the health is that the accumulation of GSSG due to oxidative stresses is directly toxic to cells, including apoptosis by activation of the SPAC, MAPK pathway. Glutathione depletion triggers apoptosis, although it is unclear whether it is mitochondrial or cytosol pools of GSH which are the determining factor. Perhaps the best indicator of the importance of glutathione is that its cellular and mitochondrial levels are directly and highly associated with length and longevity. If you take two 50-year-old males, draw their blood and assess the glutathione levels, the person who is healthier with no comorbidities, no diabetes, no hypertension and no other diseases will have a significantly high glutathione level than the similar age person beside him who has all the comorbidities. Functions and actions of glutathione on human metabolism are really numerous. Glutathione provides a key defense against oxidative stresses, which is a factor in aging and many other diseases. It is involved in the biosynthesis of leukotrienes and prostaglandins and also plays an important role in the storage of cysteine. Hepatic protective. Glutathione is extremely hepatic protective, especially if you are drinking regularly or you are an alcoholic. It is a strong detoxifying agent at the pre-biliary level. It regulates the cellular events such as gene expression, DNA and protein synthesis, cell proliferation and apoptosis. The molecule fiber is also used of great use in malignancies, post-chemotherapies, liver cirrhosis, insulin resistance, type 1 and type 2 diabetes. The list is rather abridged. The real list is very, very long. Skin fairness from glutathione is just a side effect. This is not the primary indication for glutathione therapy. Unfortunately, close to 70% of intravenous glutathione therapies in India and abroad are used by cosmetologists and dermatologists to make their clients' skin fairer. Anyway, as there is no overdosage of glutathione, these people can be pardoned and excused. Michael Jackson is a simple example of a person of Negroid race who was black and not confident of his complexion, and over the years change his complexion to white by massive doses of glutathione. In our IAOS channel, you have seen many videos of glutathione along with hydrogen molecules infused into the saline and then infused into the blood. Our previous recommendations was to mix 1.2 grams of lyophilized glutathione in 500 ml of saline with other nutraceuticals and infuse it slowly into the patient. This recommendation has now been changed because reconstituted lyophilized glutathione oxidizes rapidly, and our experiments showed that 1.2 grams of lyophilized glutathione, if reconstituted, oxidizes to 50% in 13 minutes after mixing. Thus, we now recommend that we give glutathione directly, slowly as a bolus, and then we give a hydrogen vitamin infusion, intravenous molecular hydrogen therapy. Previous IAOS recommendations was mixing 2 grams of vitamin C, 1 ampule of vitamin B complex and 1 ampule of vitamin B12 along with glutathione, and bubbling this solution solution with 600 ml of per minute of hydrogen and infusing through a vein for 10 minutes. I am showing infusion for myself, and this method is not what we are following now. After more research, documentation and analysis with trials, IAOS antioxidant therapy protocol has undergone fundamental changes, and the subsequent videos show the complete steps with the correct chronology. The hydrogen machine is switched on and the hydrogen output is tested. This is the switching on of the hydrogen machine. We just power it on and we can put it up to 8 hours. I normally like to keep it at the maximum to ensure the machine works nicely. We can see the hydrogen being bubbled through water and that the machine is working. Gloves are donned and it is checked if the tray has all the necessary ingredients. Here I am wearing my glove and ensuring that we have a multi-dose vial of vitamin C. We have a glutathione which also contains vitamin C, small ampule, which we won't waste. This is methylcobalamin, 1000 micrograms in its special package. This is 500 ml of normal saline. Unlike the past, we use now 500 ml of normal saline rather than 100 ml of normal saline rather than 500 ml. The infusion contents are 100 ml of normal saline, 2 to 3 grams of vitamin C, 1 ampule of vitamin B12, 1 ampule of vitamin B complex. The appropriate quantity of vitamin C is extracted in the syringe, and you can see we are using you're opening up a syringe, the needle is fixed, the multi-dose vial is opened, This contains 500 milligrams per ml. We need 4 ml for 2 grams of vitamin C. For this girl, we are only using 1.6 grams, so we are using 1 ml of vitamin C, another 6 grams of vitamin 600 milligram of vitamin C, which is available in the glutathione combination. The vitamin C is first injected into the 100 ml of saline. Thereafter, a needle is changed. The needle is left into the 100 ml saline bottle because we do not want it to be pricked repeatedly. Another small ampule of 600 ml, 600 milligrams of vitamin C is there, which is withdrawn and added. Now B complex vitamins are withdrawn in the syringe and added as shown in the video. You can see that the 600 milligram vitamin C has been added. The needle is retained in the 100 ml saline solution. One by one, the vitamins are opened, cracked and added. We must always keep a small saw blade because many a time while trying to snap off the top of the vial, we may crush the bottle and the glass may be splintering all over the place. So to recapitulate, we have 100 cc of normal saline. Into that, we have 2 grams or 3 grams of vitamin C as may be required, and then 1 ampule of vitamin B12, 1 ampule of vitamin B complex, everything injected through the same needle in the bottle so that we do not dilate the entry part of the saline bottle. A transfusion set is now pushed into the bottle, which is reversed. The bulb is primed and all the air is let out. So here is a video that shows you a transfusion set being opened and the sharp tip at the end of the bulb is being pushed into the bottle. The bottle is inverted, hung on a stand. The bulb is primed, the tip is opened, and we ensure that the saline is flowing freely. As we are going to bubble hydrogen into the bottle, we do not want the bottle to expand and explode. So we already put 2 air vents on the top and then we lock and block the saline set, and it is only at this stage that we start bubbling the hydrogen and mixing the glutathione. As we are bubbling 600 ml of hydrogen per minute, a few needles need to be put into the top part of the bottle to ensure that the bottle does not balloon or push out the transfusion set. Another drip set is now connected to the hydrogen out of the machine, and the hydrogen is bubbled through the prepared saline. You can see this is the procedure. We are now opening another ordinary transfusion set, knots and obstructions have to be removed. This is a real-time video and we have not done any pause or editing in the video to show you exactly what is the process. At the tip of the hydrogen out tube, we connect the bulb and the needle is connected into the bottle. You can see that there are hydrogen out vents outside and molecular hydrogen 99.9% is being bubbled into the bottle at the rate of 600 milliliters per minute. Compared to the previous method which we were using, same 600 ml per minute flow was bubbled through a 500 millimeter of saline for 10 minutes and the amount of hydrogen diffused was only 1.2 ml hydrogen per milliliter of saline. With the saline volume reduced to 100 ml and the hydrogen bubbling remaining at the same speed of 600 ml, we are diffusing 6 ml of hydrogen per ml of saline at any given time. Thus, 5 times more hydrogen in the form of microbubbles enters the body. That is very important. Now is a very important step of reconstitution of lyophilized glutathione. This is done at the same stage as the nurse is getting the vein because we desire to administer the gluta the instant the reconstitution is done. You can see that the nurse has started with her venflon. She is locating the vein and she is about to insert into the vein with a smiling patient. Around that time, I am injecting 10 cc of distilled water into the bottle for producing glutathione solution which is non-lyophilized. Introduction of the glutathione happens almost at the same time as we start with a slow bolus of the entire 1.2 grams of glutathione dissolved in 10 ml of distilled water. You can see that the venflon has been anchored and now I am injecting 1.2 grams of glutathione. The glutathione while is being shaken, high quality lyophilized glutathione takes time to dissolve and it is better to have a venflon in place before the glutathione is extracted because by this modified method I have found absolutely fantastic results more in my movie and modeling characters than in patients. But diabetes have reversed, hypertension have reversed, and many numerous metabolic disorders have been reduced by this procedure. Trick is very simple. Just push half ml weight, half ml weight, half ml weight, and in this manner you push the entire 10 ml into the vein. This 1.2 milligram glutathione has to be pushed very slowly. The patient will smile and tell you that she feels the medicine enter into her veins or into his veins. After this, I will also be doing this procedure on myself, and you can see my reaction as I am old and acclimatized to all sorts of discomforts. Even a bolus push into my body did not cause me any discomfort. But for young women and younger patients, we must be little careful about not pushing the glutathione in a rapid way. Half cc and weight seems to be a good policy. By this time, the saline set with all our intraceuticals is being bubbled well with hydrogen. The same is now attached. We must start a little slow because this small vial has got about 2 grams of vitamin C. Rapid flow of vitamin C will cause little pain. So we go a little slow. Once the drip is over, the venflon is removed. Actually, there is a slight mismatch in the video where this part has come a little early, but doesn't matter. This has shown the procedure clearly and fully, as no anticoagulants are used here. We have to just tape and leave it free. The next video shows the microbubbles entering the blood directly. These microbubbles act on the mitochondria and cause dramatic effect within 24 to 48 hours. You can see the whole procedure, how the hydrogen is entering the solution and how microbubbles are forming, and these microbubbles are traversing through the drip set into the patient's body. Molecular hydrogen going into the blood directly stimulates the mitochondria and causes fantastic results. Ignorant biomedical engineers keep calculating the hydrogen solubility in the water at room temperature and pressure, which is irrelevant to the antioxidative activity of the bubbled hydrogen in the cocktail. So, this is for you to understand how a hydrogen therapy intravenously is performed. As her hydrogen is exhausting, I am already mixing a cocktail for myself, which I will be infusing on myself. We have already shown the missed video where we removed her drip set and put a paste. The next subject is myself. The complete steps with commentary are shown subsequently. Here I myself take about 3 grams of vitamin C, that is about 3 ml or 4 ml of vitamin C from a multi-dose vial, and of course the glutathione brand I am presently buying before IAOS launches its own brand comes with 600 milligram of vitamin C in an ampule that again is added to this. So this particular infusion, I am taking about 3.6 grams of glutathione. Thereafter, I am mixing vitamin B complex, vitamin B12, the nutraceuticals which I normally take for what I believe will regress my age, improve my performance and increase my health. That goes into the bottle. Then the bottle is inverted and hung on the hanger after a drip set is pushed into it. The bulb of the drip set is pressed to prime it, and then we open the drip set and allow the solution to flow out, take out all the air bubbles. Next is opening another drip set. But before that, we have to connect one or two or even more air vents on the top, because this is a 100 ml saline concoction where 600 ml of hydrogen will be bubbled per minute. We do not want the bottle to explode. Now hydrogen bubbling has started. You can see the hydrogen bubbling. Only at this stage is the glutathione is going to be mixed. I have already taken my seat on the couch and I am ready for my Venflon, while my assistant is withdrawing 10 ml of distilled water, injecting it into the glutathione. My sister has put a tourniquet and she has seen that my vein is good and it will go in. I signal my assistant. She mixes the water into lyophilized glutathione and the ampule is shaken or stirred. IAOS is in the process of getting a ultrasonic vibrator for mixing injections, where in 30 seconds lyophilized glutathione can mix fully and thoroughly by the vibrations of the machine. Now, once it is mixed and ready, my nurse is trying to get my vein. You can see that I am shaking the vial to ensure that it is shaken and the entire lyophilized glutathione is mixed in the water, and this is drawn now by my assistant. The same will now be administered into my vein by the senior nursing staff. Again, the instructions are the same. It has to be administered slowly, half milliliter at a time, exactly half milliliter at a time. If you push this glutathione as a bolus in itself, it will be irritating to the nerves and the patient or subject will feel some sort of stinging or burning feeling in the entire thing of the nerve, which is what I am explaining to the nurse. So, it has to go half ml at a time. Once the glutathione is fully in, we connect the hydrogen drip. The hydrogen continues to flow at 600 ml per minute, 6 liters every 10 minutes, and the whole drip takes about 8 to 10 minutes to flow. You can see the micro bubbles in the bulb. These micro bubbles are directly going into blood. We are not talking about hydrogen being dissolved or diffused in the blood. We are showing hydrogen micro bubbles which you can see in the bulb, and the micro bubbles are going into the body as hydrogen gas which are acting on mitochondrial level, and these are the ones that produce dramatic results. I could actually get a 7 kilogram weight loss by repeated use of hydrogen infusions. My conclusion: you cannot change the planet you live on, the pollution around you, and the damage it constantly tries to cause you. However, you can take the help of ethical biohacking and science to help you to regress your age, stay younger, happier, and healthier. Only medical personnel can message me at the above number with a WhatsApp message. My request not to call me. Have a nice day. Have a nice day. Good day. Thank you.